Plus, I want to thank the individuals that will present and be panelists today, but we'll introduce those a little bit later on. FIP's vision is a world where everyone benefits from the access to safe, effective, quality, and affordable medicines and health technologies. FIP's mission is to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. And we're really pleased to deliver the event. My name's Robert Sindelar, and because I serve as the chair of the FIP Data Intelligence Commission, I have the wonderful opportunity to serve as a co-moderator for today. The next slide, please. And I'm joined by Chris John, who does a fantastic job as the FIP lead for evidence and the impact digital events for this year. But he also is the FIP lead for data intelligence and serves as the Data and Intelligence Commission secretary. So Chris, thank you for joining me with this. Next slide, please. The webinar is being recorded and will be live streamed via YouTube. The recording is available on the FIP events website. You may ask questions using the question box provided. You're welcome to provide feedback and under the webinars banner. And also, if you're not, we really encourage you to become a member of FIP. Next slide, please. Today's program, we hope, will really be exciting for you because it's certainly at an important stage for data and intelligence. We'll have a brief introduction, really developing a needs-based data-driven culture. We'll have presentation on the FIP development goals from both a regional and national perspective. We'll have a development and use of indicators to track the progress of those FIP development goals, and we'll have a panel discussion. We will bring that sort of together. And today is a special day, not only because this is the first of 6 regional programs around this, but also since this is in the Western Hemisphere, today is the Thanksgiving holiday for in Canada. It is also Columbus Day, either today or during the week. There's various Christopher Columbus celebrations around North, Central, and South America. And so it's a special day to hold this. Next slide, please. We will talk about why a needs-based data-driven culture is important. We will try to identify approaches to measuring that progress. We'll describe the FIP development goal priorities and how the indicators were developed, and hopefully explain how monitoring and evaluation of those development goals contributes to evidence of outcomes and impact. Next slide, please. Chris?
Thanks, Bob, and hello, everyone. And of course, we couldn't be here today without the FIP development goals. And these were launched by the International Pharmaceutical Federation in September 2020, and they're a key resource for transforming the pharmacy profession over the next decade, globally, regionally, and nationally. Today's event is obviously a regional event, and we will be doing a series of regional events across all the 6 World Health Organization regions over the next couple of weeks. But these development goals, they align with the International Pharmaceutical Federation's mission to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. And they are really, as I've said, to transform pharmacy in alignment with wider global imperatives, the UN Sustainable Development Goals. So these development goals all map to the United Nations development goals, particularly the development goal around health, and therefore they support continuing progress towards universal health coverage. All of the evidence and impact events that we've been running in this series relate mainly to 2 development goals 11 and 12. Development goal 11 is about impact and outcomes. All the development goals, as you may know, split it into 3 elements. We've got a workforce and education element, a practice element, and a science element. So with development goal 11 on impact and outcomes, the workforce element is about gaining evidence of the impact of the pharmaceutical workforce within health systems and health improvement. The practice element is about evidence of impact of pharmaceutical services, again, in terms of health systems, their outcomes and quality of life, improved efficiency of health systems and sustainability. And the science element is about strategies and programs in place to enable timely access to safe, effective, and affordable medical products. This event also relates to Development Goal 12, which is pharmacy intelligence. Again, splits into the 3 elements, and this is really about, with workforce, collating and sharing workforce data and workforce planning activities. With practice, again, sharing and utilizing evidence on service provision, development and delivery. And with science, to have data-driven decision strategies to accelerate pharmaceutical research, development, manufacturing and market approval of medical products. So that's really the focus for this evidence and impact series. Of course, we have the Global Pharmaceutical Observatory is the engine room of all global pharmaceutical data collection, and the GPO will measure and monitor progress towards development goals, mainly by using the indicators that we're going to be talking about today. Its mission centers around data, intelligence, advocacy, and reporting. And we know the importance of data, particularly over the COVID-19 pandemic, and for data to provide us with evidence which demonstrates impact. So our first task is always to collate valid global data on those elements: workforce, practice, and pharmaceutical science. And we must undertake comprehensive analyses of collated data to provide accessible, high-quality intelligence. And all this must be communicated innovatively to promote our member organizations' impact on health. So there's a very important advocacy element there. This communication will often be via what we call the FIP Atlas, which is our visualization platform for displaying our data and intelligence, and you'll hear a bit more about that later. And finally, we will provide evidence-based strategic information, reports, and guidance on the application of pharmaceutical science, policies, practices, and services. Just a brief overview of the work that the FIP Global Pharmaceutical Observatory is undertaking. It has a program of work, first and foremost, called the Multinational Needs Assessment Program. And this is really taking a tried and tested needs-based approach to addressing data and development goal challenges through the development of this program. And we really set up data collection and analysis based on needs, based on nations' needs, looking at what their priorities are, looking at what their gaps are. So the GPO collates all that data, but the Atlas, which is what I've just described earlier, is a platform for showcasing our members' needs and priorities, supported by the data from the GPO and allowing FIP to identify opportunities for developing pharmacy with, for, and through our member organizations. The GPO database, which we're building, is the repository of FIP's pharmacy and pharmaceutical science data, and it contains data that inform the indicators that we'll be using to track progress against the development goals. The FIP development goals provide the framework for needs assessments and prioritization for member organizations to undertake, relevant to their national situation. And we will be in the panel discussion talking a bit more about regional and national situations across the Americas and how data might be used to address monitoring progress. In turn, the priorities can provide each organization with the foundations for mapping the progress and transformations for their workforce, practice, and pharmaceutical science. So today's event really is about indicators and how we create them, and really showing that there will be a way to measure and monitor progress and transformations for nations, member organizations, regions, workforce, practice, and pharmaceutical science against the development goals. And as I've mentioned, this will be via the data that is often collected by the Global Pharmaceutical Observatory. Bob's going to be talking a bit about a key piece of work. The Data and Intelligence Commission has made recommendations very recently, which have been approved by FIP leadership. And just to say, finally, the other part of the GPO work program is these events that we run on evidence and impact. So I'll hand you over to Bob, who's going to talk a bit more about the Commission.
The Commission meets on a regular basis and has representatives across the globe and across the functions and the member organizations that are part of FIP. Amongst the work that the Commission has done, it always provides strategic advice to FIP on terms of advocacy and delivery of the GPO program. And as part of its work across the last couple of years has been 8 recommendations as steps to the development of a needs-based data-driven culture. These include that FIP should develop common and accessible guidance and terminology on data collection, processing, synthesis, and analysis, that FIP should adopt and adapt for the practice of pharmacy and pharmaceutical sciences, the WHO's data principles. FIP should consider what it can offer to member organizations as added value to their membership with respect to data and intelligence. FIP should serve as a global resource for collecting and disseminating the best data, also practices and successes. Digital health population, health management, and data literacy learning outcomes should be incorporated into pharmacy's initial education and training curricula and post-registration competency frameworks. FIP should continue to advocate for pharmacy to have full access and writability to the patient's electronic health records. The FIP GPO should develop a clear and transparent governance process to enable data sharing between and amongst member organizations. And each FIP structure, constituency, and forum should identify a data champion who will be supported by the GPO team. Next slide, please. Chris?
So the main purpose for being here today is to really focus in on the FIP development goal indicators. I mentioned earlier that the FIP development goals, there's 21 of them. They each have 3 elements: workforce, practice, and science. And then further down the pyramid, as you can see on the screen now, there are also mechanisms, the tools, the structures to facilitate and support the process of transformation towards development goals. And then beneath the mechanisms, and why we're here today, is we have the development goal indicators, which are measuring and monitoring the progress of the development goals. So indicators will be used to support member organizations and nations to identify what improvements are needed, to set priorities for quality improvement and support, to create national dashboards displaying data against priority development goals. This is a key way of monitoring progress. To benchmark performance against international data, against nations with similar health systems and similar approaches. To support national quality improvement schemes, and to demonstrate progress that pharmacy is making in support of health systems outcomes. So that's very important for advocacy of the profession. So I'll hand back to Bob.
So we'll have our first speaker today. I wanted to let everybody know that all of the speaker bios are being posted on the chat. So if you want to look at detailed bios, because whatever our introduction would be, it really wouldn't capture all of the skills, knowledge, and successes of the individuals that are presenting today. So it should be a good program. But I would like to introduce Dr. Lina Bader. She's the FIP Lead for Equity, Sustainability, Policy, and Development. She leads the FIP Development Goals program of work. She is a pharmacist and has done a tremendous job on this portfolio. Lina?
Thank you so much, Bob and Chris, for this. And thank you, Chris, for setting the context behind this. So I'll just be focusing a little bit today on looking at the FIP development goals, but more from a regional and national priorities perspective. And as Chris has mentioned, when we launched the development goals, it's intended to serve as a framework to support countries identify their priorities. And of course, I know the discussion today is about indicators, so we have to focus on that. But we hope that providing some of the background on the priorities identified support that discussion, because we cannot aim at every country, at every region to reach all 21 goals. That's obviously the ideal. But priorities are the starting point, and we need indicators to measure progress against those. So I'd like to give you a very, very brief snapshot of the global priorities we've identified, looking at the regional and some of the examples of national priorities from the Americas region. Next slide, please. Everything I mentioned today and a similar overview across all the regions with the detailed background you can find in the report, the FIP Development Goals Report 2021, Setting Goals for the Decade Ahead, which you can find on the microsite for Development Goals, developmentgoals.fip.org, and my colleagues, I'm sure, will insert the link for that. So feel free to have a look at that at your own time for a detailed description of what I will summarize today, but also having a look at the other regions that may concern you. Next slide, please. Thank you. So FIP committed to assisting our members in assessing and tracking their needs. That was the moment of the launch of the development goals where we made this commitment. And to follow through with this commitment, we launched immediately after the goals in 2020, a new engagement strategy with our member organizations that intended to use the goals to identify and understand their needs and priorities, as well as combining and collating these priorities across the regions and comparing them and seeing how they differ or not differ across the different regions and nations. So 2021 saw the launch of this new regional engagement strategy, which continues until today, and the summary or the results of that engagement strategies will be presented shortly. Next slide, please. So what does a regional engagement strategy look like? And there will be some animation on this just to summarize what we did over 2021. So we started early that year in April with conducting high-level meetings. We started our first regional engagement meetings virtually, of course, following the COVID restrictions of face-to-face meetings. We continued over the summer in July and October with a second set of regional engagement meetings to build on the first ones. And in October, we held some in-depth member interviews to give us a little bit more insight into the priorities that were identified in the months before. November continued with a third set of regional engagement meetings, and these engagement meetings continue this year and will be continuing in the future of FIP. So as you can see, plenty of opportunities we've had and we've created to identify and collect these priorities. So I'd like to start by giving you a global snapshot of the priorities as identified. So this is a global overview, as you can see in this graph, symbols for the different regions. Of course, now we're discussing America, so that's the yellow in the bar chart. And we have collated the data across the world, obviously based on member organizations who have given us the data. So this figure displays the number of member and observer organizations that have identified each of the 21 goals as a priority. Let me just go through a couple of examples. For example, goal 7, which is the highest column that you see there, was identified as a priority goal by 16 different members across the world. Goal number 13, which is policy development, goal number 19, patient safety, were identified as priority goals by a close 15 different members across the world. So these are just some examples, and you can see that there is variation across the goals, and we have some goals which haven't been identified a priority as much as the rest, and we are investigating why and trying to understand our members' needs in that and how we can support them. Some of the really obvious ones are equity and equality, goal 10, goal 6, leadership, and interestingly, goal 11 and 12. But we think that this is due to a lower level of understanding of the importance of these goals compared to the other ones, which were more obviously related to professional development areas that everyone is much more familiar with. So we're working on understanding some of these. And of course, none of this is set in stone. We completely recognize at FIP that priorities change over time, and this exercise will be conducted frequently on a cyclical approach to keep understanding the needs and how they change over time. The next slide presents a global snapshot of those goals. So just to make it easier for everyone to interpret that graph in a different way, we have identified 3 levels of priority goals on a global level. So 8 for first level priority goals. These are the most identified as priority: academic capacity, number 1, number 4, advanced specialist development, number 7, which is advancing integrated services, 13, policy development. 15, people-centered care, not surprising. Patient safety, number 19. Number 20, digital health, and number 21, sustainability. The second level priority goals are also on the screen, 8 of them. Early career training, quality assurance, competency development, working with others, medicines expertise, communicable diseases, etc. And the rest as third level priority goals. This is by no means saying some are more important than others. This is simply based on the frequency by which they were identified as priorities. In the final part of my short presentation, and the next slide, I'd like to very quickly do a deep dive into the Americas region and what has come back from us. In total, we've had 6 member organizations report to us on their priorities in this region, and I'd like to quickly go through them with you. So the next slide presents a snapshot of the regional priority development goals for 2021 by this region. And of course, they're very similar to the global ones. And we can see first level priority goals: academic capacity, quality assurance, policy development, and people-centered care as the top priority areas, and the other goals as second and third level. We don't tend to generalize that these goals are priority across every country in that region, but this gives us a really good way of summarizing or understanding the top priorities in that region. And I know the panel discussion later on will delve deeper into how these are relevant today. And in my next and last slide is a summary of what the 6 member organizations of that region have reported back to us. So we've had 4 countries, Canada, Costa Rica, United States, Uruguay, and you can see how they have selected some of the goals that are priorities. You can see how the priorities are different across the regions. So on my very last note, I'd like to say that our role at FIP, following identification of priorities, that we will be following up, and we have started this already, following up on these priorities to see whether there are any updates or new priorities have emerged. As I mentioned, this is a continuously evolving area. We are working actively to provide support to additional members in assessing, identifying, and mapping their needs, and we'll be adding and building on the 2021 data we have. And we are working also with our member organizations to identify best practices on how they've used the development goals to identify their needs, but also develop their strategies for the profession nationally. Finally, we will be continuing to support and guide our member organizations on how they can use and implement the development goals. And of course, today's topic, the indicators, is of critical importance for that. Thank you so much, and I hope this was helpful. Thank you, Chris.
Thanks, Lina. And very, very insightful presentation there on current priorities across the globe and the Americas. If you have any questions, please put them in the Q&A box, and we will make sure Lina sees those, and we can follow up on those. So moving onwards, I'd like to introduce our next 2 speakers. We have a double act for you now, and it's a pleasure to introduce 2 colleagues from the Global Pharmaceutical Observatory team, Farah Aqqad, who is our FIP Regional Engagement Support and Development Manager, and who has particular expertise working with member organizations across all of FIP's members. And Diala Koudmani, who is a researcher, collaborator of ours, and has been doing a great deal of research on the FIP development goal indicators. So I will hand over to Farah first, and welcome.
Thank you, Chris, and welcome everyone. I'll start my presentation with a quick introduction before handing it over to Diala, building on what Lina presented. So in 2022, FIP published a set of 2021 development goals. As part of the FIP development goals, a growing set of global tools, structures, and programs are also available to facilitate and support the process of transformation. During 2022, in 2021, FIP focused on engaging with members across the world and supporting them in identifying and mapping their needs on a national and regional level aligned with the FIP development goals. My colleague Lina presented some of these that we collated last year. In addition to that, many member organizations are also mapping the development goals based on their outputs, their activities, their structures, and their priorities. Using the FIP development goals as a framework, we were able to answer the following question. What is the pharmaceutical development needs to meet national and global healthcare requirements? Which is what we're doing using our engagement strategy. But the question now is, now that we've mobilized the use of the DGs needs assessments, how can we monitor our progress towards meeting the identified needs to improve pharmaceutical health delivery systems? So it's member organizations, how can they monitor their progress against nationally identified development goals, or regionally? And FIP, how can we monitor our progress globally towards the development goals? During our global Congress in Seville, we continued our discussions on FIP development goals mapping and implementation efforts by different member organizations. And we will continue to do so with our members to share best practices, experiences, approaches from our different member organizations. The FIP Global Pharmaceutical Observatory and the Data and Intelligence Hub has designed and developed progress indicators to support tracking progress towards these goals. For measuring progress toward identified national development goals, as we mentioned, and needs, and which will facilitate national, regional, and global monitoring. So I'll now hand it over to my colleague Diala to give you an overview about these DGs indicators. Diala, over to you.
Thank you, Chris. Thank you, Farah, for this introduction, and thank you all for joining us today at this event. I will start now by giving a brief overview of the project, highlighting the different data collection and data analysis method used throughout the development process of the Global FIP Development Goals indicators. As we can see here on the slide, the process involved conducting a series of qualitative research methods, including a desktop literature review, followed by a Delphi method, and this was the stage 1 of the project. Later, a quantitative online questionnaire was also incorporated into the second stage, or the global engagement stage. And I think many of our today's attendees are familiar with this questionnaire image presented here on the slide and answered this questionnaire. So I would like here to thank you all for your valuable contribution. For the analysis, also qualitative and quantitative methods were performed to analyze both stages to develop the final presented list of the global FIP development goals indicators. Next slide, please, Chris. In this slide, I will go into more detail about the methodology and the data collection process. As I mentioned in my previous slide, a mixed method research design was used, qualitative and quantitative. The aim of the stage 1, the qualitative stage, was to identify the initial draft list of global FIP development goals indicators. Therefore, the development of proposed indicators provided or involved first a content analysis of the relevant documents and the existing data collated from global published and reports by WHO and FIP. This was followed by a Delphi process to identify and develop potential indicators aligned and mapped to the 21 development goals. The aim of the Delphi method was to reach an initial consensus on the proposed list of indicators assigned by an expert group, and this led to the development of 21 unvalidated proposed list of indicators covering different aspects of each development goal and ready to use in the next stage. Subsequently, thank you, Chris. In the stage 2, or the global engagement stage, the aim of this stage was to construct the validity and the reliability of the proposed and validated development indicators produced or generated from the previous stage in terms of the indicators' relevancy and availability or the accessibility from a global perspective. So the outcomes of the Delphi method were presented for wider engagement and used to conduct a global cross-sectional online questionnaire to assess and validate the relevancy and availability of the 21 proposed list of progress indicators. The 21 questionnaire links were disseminated during a series of, thank you, Chris. A series of FIP development goals or FIP digital events held in 21. One event was held for each DG, where the attendees of each DG event, who were international pharmacists working across different sectors and career stages, participated in this short questionnaire. Also, a follow-up or an invitation email was sent to global pharmacy leaders who represent their professional leadership association to participate in this short questionnaire through the FIP different sections as well. Next slide, please, Chris. Yeah, this slide shows the analysis and main outcome of the stage 1. As I mentioned, a content analysis approach was undertaken to draft the primary pharmacy core indicators. And the output, as we can see here, was the development of the GPO core indicators handbook, comprising a list of 127 pharmacy-related core indicators. This handbook list was used as input for the Delphi process. Afterward, an expert group of international pharmacists volunteered to contribute in an anonymous 2-round Delphi method, and they were asked to assign the relevancy of indicators listed in the GPO indicators handbook and the published FIP development goals mechanism against each development goal. Then the expert group was also asked to provide further comments, reviews, revise the output of the first round. Eventually, and after amending and incorporating all feedback from the expert group, initial consensus was met, and the 21 proposals of 165 unvalidated indicators were developed aligned to the 21 DGs. Then the output of the Delphi method was formatted into a questionnaire to be used for the global engagement stage 2. Next slide, please, Chris. Here, moving on to the descriptive data analysis for stage 2, the online questionnaire or the global engagement stage. A total of 755 participants responded to the 21 online questionnaires from different practice and the 6 WHO regions. As we can see here on the map, that the Western Pacific and European regions were the regions with the highest response rate, with 31 and 23, around 23% respectively. And the responses from the other 4 regions were nearly evenly distributed, ranging from 10 to 12% of the total response rates each. Can you move to the second slide, please, Chris? Okay, this slide is a bit a heavy slide, and it's showing the statistical analysis performed for the same stage. Based on the 2 questions listed on in the online questionnaire about describing the relevancy and the availability of the proposed indicators, 2 selection criteria were set to determine if an indicator is a globally valid and measurable indicator. So the first criterion, as you can, as shown here on the slide, is the relevancy of the proposed indicators to measure the progress for each relevant DG from a global response. And the second criterion is the availability or the accessibility of these proposed indicators in different countries. So the analysis of the questionnaire responses was performed using 2 statistical approach. This figure shown here or shows the first approach, which is the outlier detection, using the box plot examination to identify the not relevant indicators. And the analysis resulted in the exclusion of 10 indicators from the initially proposed list of indicators, I mean from the 165 indicators. If we can move, Chris, please. The second approach here is established by setting 3 evidence-based thresholds, indicated the level of performance or the level of usability of the indicators. As illustrated here in the diagram, for example, if the availability of an indicator is above or equal 60%, it's classified as a usable indicator. If the availability is below, is between 40 to 59%, it's classified as a problematic indicator. And if the availability is below 40%, it's classified as not usable or rejected indicator. For the analysis, only the relevant indicators which passed the first criterion were used and compared with the country responses to ensure the indicators' availability and accessibility in order to meet the second criterion. And the analysis of this stage generated 109 usable indicators ready to be tested after meeting both criteria, also produced 40 problematic indicators to be reviewed later, and 16 indicators that were rejected. Moving on to the final stage or final slide. Here I will point out the resulting key outcomes. First, the main outcome is a set of correlated and validated transnational evidence-based indicators that will monitor DG progress worldwide and support countries in their process of pharmacy advancement and transformation. Second, the final list of DG indicators was also presented in the 21 DGs and across the 3 development goals elements, I mean workforce education, practice, and science, with 1 indicator under each development goal at least. We can move to the third point. Chris, please. Yeah. Here, I would like to mention something about that some DGs, particularly the ones that you can see here on the slide, DG11, impact outcomes, DG12, pharmacy intelligence, and DG20, digital health, have only 1 or 2 indicators under the final usable or the final approved list of indicators. However, the questionnaire analysis, showed that the initially proposed indicators of these goals were relevant to the context area of these development goals. They met the first criterion of a measurable global indicators in terms of relevancy, but didn't meet the second criterion, the availability and accessibility assessment in the respondent countries. But I think here we can agree, or we can say that although data and intelligence, the focus area of these 3 development goals now are considered new emerging and show rapid growth in the healthcare field, the existence of national strategies and systems of implementation is relatively limited, and then a lack of measures to monitor service impact and health outcomes is expected and not surprising. Finally, thanks, Chris. Finally, the developed list of indicators was also clustered into 5 categories to present the development goals as a second dimension. So we have capacity type indicators where data is expressed as numbers like the number of pharmacists or pharmacies, etc. We have also impact type indicators to measure the impact and health outcomes of the pharmaceutical services provided. We also have pharmaceutical services and facilities type indicators, which focus on the availability of the pharmaceutical services, facilities, and infrastructures needed. Policies and regulatory systems type indicators, which focus on the regulation and strategies as driver to shape the structure of the needed system to improve healthcare. Finally, training and professional development indicators, which focus on developing competencies and skills across all sectors and career stages. So this was a short overview of how the Global FIP Development Goals indicators were developed as evidence-driven global developmental work using research method to support tracking progress towards the FIP Development Goals. Thank you so much for your listening, and I will hand it over again to my colleague Farah. She will take you through the project next step. Thank you.
Thank you, Diala. So as we've heard from Diala, this globally validated list of indicators across all of the development goals will be used to monitor our progress worldwide and support each country in the process of transformation of workforce, education, practice, and pharmaceutical science. The FIP is preparing a tool for the selection of indicators and a framework for monitoring and evaluating this. So this in turn will enable the design of global atlas dashboards, as we mentioned earlier, that will drive and inform progress towards the development goals. If we can go to the next slide. The DG's indicators framework aims to support tracking progress of pharmacy practice, workforce education, and science elements of the development goals at a national or member organizational level. There are 3 specific objectives that will be served by this framework. First, supporting member organizations in tracking and monitoring their progress towards the development goals, ensuring that the DG monitoring is aligned with existing member organizational and national monitoring frameworks, and to facilitate global comparisons of progress monitoring and improvement activities, address data gaps, and minimize the burden of reporting. The last one is enabling global tracking of the progress of member organizations and stakeholders towards the DGs. That will be through the provision and alignment of a global set of indicators that can support in multinational review of aggregated data. If we can go to the next slide. Now, what are the intended benefits for the DG's indicators framework? This framework will synergize global, regional, and national monitoring efforts, and it will provide the following benefits. First, in order to monitor progress towards the development goals, it can be tailored to specific national and organizational contexts. As we know, there is no one-size-fits-all approach, so the development of a standardized monitoring framework will reduce the variability between nations when it comes to monitoring and integration. In addition, it will provide guidance on areas that are not traditionally measured by our member organizations and different countries. If we can go next. On the screen, you will see our proposed process for tracking the development goals. So first, we propose selecting the development goals to be tracked. So our recommendation is to follow these steps in order to determine your priority DGs. First, identify the general areas in which you're active, policies and projects that are currently in place, and prioritized, or the projects that are currently being implemented on a national level. You should also consider the pressing national needs that you wish to address and focus on. For our member organizations and stakeholders, you can then identify the top 5 DG priorities relevant to your organization's mission, plans, programs, or needs in a specified time frame. Then, based on these development goals priorities, we select the corresponding indicators. As we mentioned, indicators are useful to provide measurable results, to demonstrate progress towards the DGs, identify areas needing attention and opportunities for improvement, and supporting continuous improvement. So because we know measurement cannot be undertaken in isolation, we look forward to working with all of our member organizations towards mobilizing the use of the indicators. Next is developing a monitoring and evaluation framework. We will identify specific questions that need to be addressed in order to assess, track progress towards the DGs. For example, what is being monitored? We make links to data sources and how these will be reported. As you might be aware, monitoring refers to the observation of progress, quality of activities on an ongoing basis, whilst evaluation refers to the process of determining the worth or significance of a service or intervention related to the development goals. And finally, the Atlas dashboards. The dashboards can be an effective tool for presenting all of this data and the changes over time to inform and drive improvement. It's possible to provide a summary of a limited set of key indicators with novel ways of highlighting areas in which the profession is developing or experiencing challenges. These have potential to support regular reviews progress, monitor best practices and trends, and improve data quality. I think I reached my last slide. If you can go next, please. Thank you. I'll pass it back to Bob. Happy to receive any questions in the Q&A box. Bob, over to you.
Sounds good. Thank you very much for that really detailed and great update. And indeed, if you have any questions, by all means, submit them through the question box, and we'll make sure that we get those answered for you and get the information out to everyone. Also, remember that this is being recorded, so you'll have a chance to look at this in further detail should you wish to do that. Now, what I'd like to do is I'd like to welcome our panelists, and I want to thank each of them for the time that they're giving to participate in really this event, creating development goal indicators, bridging data and outcomes. We have 2 fantastic panelists today. Our first is Virginia Olmos. She is a FIP Vice President, a member of the FIP Data and Intelligence Commission. Okay, and she represents the Uruguayan Association of Chemistry and Pharmacy. Her detailed bio is in the chat for you. Our second panelist is Dr. Eduardo Savio, and he's president of the Pharmaceutical Forum of the Americas. He's a former vice president at FIP Bureau. He serves as the head of nuclear pharmacy and research and development for chemistry and biomedical areas in the Uruguayan Center for Molecular Imaging and he's been the editor of the Uruguayan Journal of Pharmacy and Chemistry for 25 years. Our two panelists, fantastic. If I might start, maybe the best way to look at this is, do the regional development goal priorities described earlier in Dr. Lina Bader's session resonate with your national needs?
Well, I started. Thank you for the invitation. Excellent presentation. Thank you, Bob, Christopher, Lina, Farah, and Diala. First, I'm going to comment some aspects related to Uruguay because I am Vice President of Association of Chemistry of Uruguay, and then I will comment on some point in the regions. With my colleague, Eduardo Savio, we have complementary visions because he is the President of the Forum of America. In our region, we can identify ourselves with many of the 21 goals described by FIP. However, we are more distant from some of them. Specifically, I'm interested in talking about 3 of them, 18, 19, and 20, because we have some interesting progress in that. Goal 18, access to drugs, devices, and services. I emphasize that in Uruguay, the health system is very good. The entire Uruguayan population has the right to healthcare systems. We have different models, private, co-pay, or public. For high-cost medications and high-cost devices, we have a fund of national resources where each worker contributes and the entire population can access the medication or devices at no cost to the patients within established protocols. For goals 19, patient safety, we have developed safety commissions within each hospital and that reports to the Central Patient Safety Commissions within the Ministry of Health, where all issues associated with the use of the medicines that can be a risk to the patients. Finally, for the goal 20, digital health, in our country, a government agency that developed electronic medical records and had defined a national dictionary of medicine that uniquely identifies each pharmaceutical and related product. Another example of digital health information about the coronavirus, so in applications, something that the several countries in our regions. Not only do we need to generate more data, but also make it public. Surely, the fact that we do not have a regulatory agency does not allow us an openness in this data. Maybe Eduardo can continue, and in the last question, I comment from the American region.
Okay. Thank you, Virginia. Good morning or good afternoon. Thank you, Robert. Thank you very much for the fantastic work of all FIP team in this area. First, I would like to thank and appreciate a comment from a participant that's mentioned that today is the celebration not of Columbus Day, and no more, but the Native Indigenous Day. Yes, it's a common mistake that we still keep on doing this. Thank you very much for this clarification. I think that the topic that gathers today from the Pharmaceutical Forum of the American, we have some coincidence and some complementary visions. We have also selected 15 DG, people-centered care, as one of the priorities, but at the same time, we would also think that it's very difficult to have a single priority, but we would like to link it, certain priority to other ones. For example, this people-centered care, we would like to be linked to working with others, also integrated with number 7, advancing in integrated service, because we like to how can a community pharmacies or services that are developed in the first level of the health system are linked to the hospital pharmaceutical services. And even having in mind that a 15 DG is a priority, how we can measure the impact of the interventions that has been doing in the last 7, 8, or 10 years. So for us to link 15 with DG 11 is also important. So for us, it's quite difficult to assess only one specific and priority DG, and not to link this specific development goal as 15 people-centered care with working with others, with advancing in integrated service and measuring impact and outcomes. Just to mention that we have been working since 2013 with the Pan American Health Organization, with this WHO office for the region of the Americas. And we have been working in how to develop pharmaceutical services at primary health levels. With this collaboration that started in 2011, we have a strategic plan that has gone through the last 10 years. And in 2014, it has started training course with mentoring that has been delivered in each opportunity. Each of these courses takes around 6 months. And I think and the goal is to develop people-centered care with an integrated approach. After performing this initiative with PAHO along 8 years and 7 opportunities, we would like to measure which is the impact of this intervention that is aligned to one of the priorities that 4 members of the organization has identified. In a second priority that has been mentioned is the academic capacity. In the 90s, promoted mainly by the American Association of College of Pharmacy, has been created the Pan American Conference of Pharmaceutical Education. We, from the forum, we are also working together in this, creating academic capacity and working together with the conference. And this year it has been approved a project that is coordinated by Dr. Magali Rodriguez de Bidner to evaluate the multi-professional approach, how it has been integrated into the pre-graduate program along the pharmacy schools in the Americas. For us, it's very important to work together, not only the pharmacist education to be alone, but to be integrated into the health team. And so how is this approach of studying together with other health professionals, how it has been structured and regularly incorporated into the different curriculums along the pharmacy school is something that is going to be evaluated. So for us, academic capacity is also linked to working together and advancing in integrated services. Finally, there are 2 other priorities that we have identified. One is antimicrobial stewardship. There are specific initiatives that the program of PROA programs, that is program for the optimization of antimicrobials. When you say that a country level have a national program, you don't go to specific activities and you say, okay, all the countries in the American region have national program towards fighting against antimicrobial resistance. But when you go to antimicrobial stewardships, it can be on a spectrum, a school of pharmacy that has only 1 day training, a week training, another that have a very well established training of antimicrobial stewardship. And this, how this translate into implementing PROA programs, that is program for optimizing antimicrobial management in hospital settings. There are very few hospitals that has PROA programs with a specific pharmacist working the whole day. And if you ask, do you have program for optimizing antimicrobials? Maybe 100% say yes, but a small group has pharmacy integrated, and even less maybe is scared that they have a pharmacy that is dedicated exclusively to these actions. So what is quite difficult with the indicator is when you establish a general indicator, it may not go deeper to what is really happening in the different realities. So for us, it's a challenge to establish general indicators that could really measure the spectrum of possibility that takes place in the regions, and that really represents the spectrum of varieties, and not only to see the general picture. Finally, for us, communicable disease is also a priority. It is also that for us linked to work it together. In this framework, we have established a cooperation with AFA, the American Pharmacists Association, in order to have the same training for developing immunization services. This training has started in Uruguay, supported by the Pharmaceutical Forum of the Americas. And so to measure, there are countries that for decades, they have already established immunization services, but there are others as Uruguay and many other countries that are just starting to creating immunization services. So to measure how is the contribution of the professional in all these different situations, it would be very, very important. So indicators, suitable indicators, and creating and validating this indicator is quite a challenge, and not to have only the indicators separately, but integrated and mixing one DG with connecting with another. I think it would be a suitable road to move forward. Thank you.
Okay. So a couple things. First of all, for any of you in the audience, if you have questions, please do submit them to the Q&A box, and we'll make sure that we ask our panelists those before we conclude. You've talked about, the panelists have talked about a number of different priorities, different goals that you have an interest in. And maybe the best way to kind of pull this together is, since you've talked about some of those goals, is there a particular goal or two that you see really at the top of the pyramid? And if so, okay, what is the data intelligence that's needed to really track that goal?
And I would like to speak something about the data is available in Latin American region, because in this point I'd be interested in raising a regional perspective. The data that exists in Latin America in general is poor and insufficient. For example, multi-employment is common in these regions. We do not collect data on the dedication of the workforce to each activity, taking into account that there is more than one, including in different areas, such as a hospital pharmacy and community pharmacy at the same time. And so a pharmacy that has to answer a survey has to select only one, because general is requested to answer on behalf of the main activity. Another situation repeated in several Latin American countries, the lack of the professionals' presence in the community pharmacy. Knowing how many pharmacies have professional presence would be important too. Knowing important difference in the scope of the professional, while in Brazil it can be prescribed by the pharmacist, in the rest of the countries is not allowed. To know in which countries pharmacists can immunize in the community pharmacy is another interesting fact. Analyzed, but also in which step of the immunization chain pharmacist participation is important, in which extent not only to know that our participation is taking place, but how deep, how important, what does it mean for other stakeholders, which is our impact is trying to resolve. It would also be interesting to know the occupation and remuneration by gender. In the profession, we exceed 70% of women pharmacists. Knowing the inequalities that are a reality in the region should be among the concerns. We have realities in some aspects similar, in others very different. To introduce and develop a strategic plan. To implement actions and to measures, we need data before, during, and after any intervention. Data is crucial in our organization. Thank you.
Great. Thank you very much, Dr. Olmos. Are there any other final comments by our panel?
Yes, Robert, just a final comment. I would like to add that data, as Virginia has said, is limited. It's very important to go further and deeper. And the only way if we work together and we collaborate to generate this data. The data in the American, mainly in the Latin American regions, is almost unavailable. And we have to work a lot. I think that was for me quite important is that the priority were answered only for 6-7 organizations from 4 countries. And that's a weakness that we have in our regions. We need to know what other people think and which are the priorities of everybody. And if we don't have the priority and we don't have the answers of everybody, the data for the future will not be strong enough. So we have to work together to have strong data in order to take the suitable decisions. Thank you very much.
Great comments. Chris, I'll ask my colleague to sort of wrap us up.
Thank you, Bob. I'll just take us through some final slides. Thank you so much to our panelists there for their insights into development goal indicators and data across the Americas. We've heard today about the work of the Global Pharmaceutical Observatory, its work on developing development goal indicators, and we've heard about the development goals themselves, of which there are 21, I'm sure you're aware by now, and an in-depth look at a methodology of developing the development goal indicators, which we have now 109. And of course, we didn't have time today to go through those 109 indicators, but I'm sure many of them, when you see the framework that will be released fairly soon, it will be familiar to you. It's things like work capacity and workforce. Numbers of pharmacists per 10,000 of population is a good example of a workforce capacity indicator that we can use to see, you know, how much capacity a country has with their pharmacist workforce, for example. And then we've heard from the panel about the priorities they have within their nations and across the Americas. It does seem, we've heard a lot of priorities, but it does seem that there is still an issue with data not being available, which would make us think that perhaps development goal 12, which is pharmacy intelligence, is also a priority, because we need that data in order to understand what the profession is doing, how it is advancing, how progress is being made. So I just want to thank everyone for their fantastic presentations and for the fantastic insights we've had from our panelists today. You can find out more about the Global Pharmaceutical Observatory on our microsite, and the address is there, so please do go and have a look. If you are interested in other FIP digital events, then please do visit events.fip.org. We will be having another 5 regional events on this particular topic of creating development goal indicators. They will run in a similar format, but take a particular focus on the region that they are in. So I just would like to also thank Bob for his excellent moderation today, and Bob is chair of the Data Intelligence Commission, always brings very wise words. So thank you, Bob, and thank you everyone for attending today, and enjoy the rest of your day. Thank you so much.